Hello, I am Brianna Spencer, and I am a general surgery resident at Penn State Hershey Medical Center. I will be presenting our work looking at geographical differences and risk factors in mechanisms of injury related to the pediatric gunshot wounds. Gunshot wounds are the second leading cause of trauma-related death in children in America. This is preventable as evidenced by low rates of gun-related trauma in all other developed nations. Our study set out to further assess the relationship between mechanism of pediatric gunshot wound, geographic location, and other risk factors in hopes to better inform injury prevention programs. To better understand pediatric gunshot wounds, we queried the HCUP database to identify all pediatric gunshot wounds by ICD-9 and ICD-10 codes. The data was stratified by hospital location, urban versus rural. The data was analyzed using t-tests, chi-square tests, univariate analysis, and multivariate analysis. 6,634 pediatric gunshot wounds were identified in the HCUP database. The mean age was 14 years. 85% of victims were male, 47% were Black, 19% Hispanic, and 21% were white. Gunshot wounds presenting to the rural hospitals were predominantly white, while those presenting to the urban hospitals were predominantly Black. Overall, 39% of mechanisms were accidental, 51% violent, and 5% self-inflicted. In urban hospitals, 52% of gunshot wounds were violence-related and 38% accidental. In contrast, in rural hospitals, only 16% of gunshot wounds were violence-related and 77% reported as accident. Multivariate analysis reveals that patients treated in urban hospitals have 3.74 times the odds of suffering a violence-related gunshot wound versus an accidental gunshot wound compared to those treated in rural hospitals. Other risk factors associated with violence-related gunshot wounds included age greater than 14 years and non-white minority group. Our research adds to the current literature that violent mechanisms of pediatric gunshot wounds are more common in urban settings. Given this, injury prevention in urban settings need to focus on gun safety and violence prevention. In contrast, in rural settings, accidental injury is much more common and gun safety should be the focus. Our study also found that teenagers were more likely to be involved in violent incidents, thus violence prevention should be targeted to children greater than 14 years, with gun safety being targeted to younger children. Our data supports other published reports that gun-related trauma is more prevalent in minority groups, thus gun safety and violence prevention programs must reach these groups and work to address the social conditions at play. Gunshot wounds are a preventable source of morbidity and mortality for American children. Understanding regional risk factors can drive prevention efforts, recognizing that violence-related mechanisms are most prevalent in urban settings and accidental mechanisms predominate in rural areas. Thank you.